First question, it was very simple question. Snowdrop or साउथ का डोसा, नॉर्थ का रोटी, वेस्ट का पिज्जा. Yes. So answer is C. If person on fat free carbohydrate rich diet continues to grow, is multiple time question is asked that if a person is taking carbohydrate, the weight is increased. We all know that when we take carbohydrate is coming to pyruvate coming to acetyl coenzyme bind with oxalate to form citrate, then citrate come out of the mitochondria and fatty acid synthesis occur in cytosol. This acetyl coenzyme is coming to malonyl coenzyme by enzyme acetyl coenzyme, yes, carboxylase. This is rate limiting enzyme. So in fed state, this citrate shuttle will be increased. This acetyl coenzyme carboxylase activity will increase. Malonyl coenzyme will increase. This malonyl coenzyme will inhibit CPT1, inhibit beta oxidation of fatty acid by inhibiting the transport of fatty acid from cytosol to mitochondria, means carnitine shuttle will be inhibited. Yes. So in this malonyl coenzyme, 90 kg man after eating which enzyme or intermediate will be active causing weight gain, means which cause fatty acid synthesis. Malonyl coenzyme is intermediate of fatty acid synthesis. It is inhibitor of this mitochondrial transport of fatty acid. This is not, yes, this is activated. Acetyl coenzyme carboxylase is activated. Citrate shuttle, yes. So answer is yes, 1, 2 and 4. 1, 2 and 4. Yes. Citrate shuttle. This citrate shuttle is also increased. Okay, dear? Which of the following is not aneuploidy? You all know Down syndrome, 21 trisomy, 13 trisomy, XXY trisomy. Yes. Bloom syndrome. We have discussed homogeneous. घर में क्या करते हो, झाड़ू लगाते हो. This is DNA repair defect. Ataxia, आटा, तेल, अपनी मैगी खुद बनाता हूं मैं, झाड़ू, बर्नर, रोटी, मूड नहीं है वाइफ का तो रोटी भी खुद बनानी है. We discuss this. Okay, definitely it was little bit. Yes. Next question, after how many cycle PCR will get half the copies of that after 26 cycle? Yes, you know, after each cycle, number of copies are double. 1 to 2, 2 to 4, 4 to 8 in this way. Means number of product would be 2 to the power n, means n is equal to number of cycle. If 26 cycle, so after 26 cycle, the number of product would be 2 into 20, 2 की power 26. So I can write it as 2 into 2 की power 25. So half of the copy of the after 26 cycle will be, yes, half into 2 to the power 26. So half is into 2 into 25. So 25 हो गया यार, बड़ा आसान है. ठीक है, 50 हो, कुछ भी हो, हमारा आंसर तो 25 है. Our answer is 25. Okay. So simply, after each cycle, number of copies double. So in half, less than 1 cycle, 26, 25 में less than half of 26 would be there. Phenomena of cancer cell consuming more glucose. Because, yes, we discussed Warburg effect. You know, yes, I have given, although we have discussed in detail, but I have given this Harper picture. In cancer cell, Warburg effect, the end product is lactate due to metabolic reprogramming. Yes, ये तो हमने रैपिड रिवीजन में भी किया था, अभी मैराथन में भी. Yes, lactic acid is produced despite presence of oxygen due to metabolic reprogramming. Means we found that this pyruvate kinase, next time they can ask, it is a tetrameric form in normal cell, high catalytic activity, while pyruvate kinase PKM2 Dimeric form. It is dimeric form, low catalytic activity. Ultimately, we say aerobic glycolysis in cancer cell, and product is lactate. So there is and product is lactate despite presence of oxygen. So absence of oxygen ruled out. Yes. Increase pyruvate to acetyl coenzyme. No, pyruvate is coming to lactate, not acetyl coenzyme. High NADH NAD ratio. Few students told that this was the option. Yes, NADH would be low. Why? Because when pyruvate is converted to lactate, NADH is converted to NAD. Okay, so this is false. Enhanced conversion of glucose to pyruvate. No, it is converted to lactate. Yes, false. So answer is A. Next question. Glucose 6-phosphate dehydrogenase deficiency table was given. Exact what was the table we don't know, but yes, if it is in the form direct bilirubin would be normal. Hemolytic anemia, yes, in medicine you have read in detail. Yes, increased indirect bilirubin, increased urobilinogen will also be increased. GLUT2 was one option. Glucose transporter 2, yes, that is glucose transporter 1, which is more prevalent. Basic glucose uptake is done by glucose transporter 1, not by glucose transporter 2. If option GLUT2 is given, that is also wrong. Okay, yes, Prachi. Now a patient, this is little bit new question, or you can say many times. Please tell me the language. Presented with hepatosplenomegaly, hypoglycemia, means liver glycogen storage disease, glucagon administration, there is improvement in blood glucose level after meal. However, there is no improvement in blood glucose level after overnight fasting by glucagon administration. Liver biopsy showed increase abnormal glycogen. If abnormal word is given without second thought, answer would be debranching enzyme, because you know mnemonic is A, B, C, D. Anderson disease, branching enzyme is deficient. Cory's disease, debranching enzyme is deficient. Yes, debranching enzyme is deficient. So I told you in marathon also that if in any question you find the word abnormal glycogen in liver without second thought, answer would be either Anderson or Cory's. In this only debranching enzyme is given, answer is this. Other than that, one important point they have highlighted, yes, that no improvement of blood glucose level after overnight fast. Giving glucagon challenge test. Glucagon, if glucose 6-phosphatase is deficient, if you give glucagon, no increase in fasting or fad state. But in Cory's disease, in fad state, after giving glucagon, glucose will increase. But in fasting state, glucose will not increase. Okay, this glucagon challenge test is done to differentiate between Cory's disease, sometimes Cory's disease, and von Gryke's disease, that is glucose 6-phosphatase. Muscle phosphorylase, you can easily, yes, if abnormal is not given, even then by this line you can mark the answer. Yes, then it was difficult question. Answer was debranching enzyme. Okay, yes. Yes, muscle phosphorylase, not. Okay, now we come to this. We found that glycine, amino acid H, this is glycine. Two ionizable group. We know that whenever amino acid there is NH3 plus COO minus, both positive charge and negative charge in equal amount deuter ion, and we found that at a particular pH the net charge on deuter ion is 0, that is isoelectric point. So isoelectric point Pi is equal to pK1 plus pK2 divided by 2. So dissociation constant of this and dissociation constant of this, if you take average, you will find Pi. But in this graph, how you will identify? What is pK? Dissociation constant. Buffer is most effective. Buffer is most effective at pH equal to pK. Means at which pH buffer is most effective, equal, that is pK. So I can say that if I add NaOH, alkali, NaOH or alkali, at this point you will find a flat line, means no change in pH, means that is buffering. So 1 pK is this pK1, flat line, this is pK2. So Pi would be pK1 plus pK2, 2.4 plus 9.6 divided by 2, that is 12 by 2, 6. Yes? Okay. So definitely they will give you, the concept would remain same. There would be no change in pH. At that point, that would be dissociation constant. Okay? pK1 and pK2. Clear? That is good. So average. So Pi is average of pK1 and pK2. The answer is 6. Which of the following is not able to take up glucose in the absence of insulin? Yes, you know insulin. We know insulin increase concentration of glucose transporter 4 at, we remember, पोपाइदा सेलर मस्कुलर मैन, हार्ट 4 चैम्बर, धक 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 करने लगा लड़की का. यस, सो ग्लूट 4 हमने निमोनिक बनाया था, एंड दैट इज एडिपोज टिश्यू. एडिपोज टिश्यू शादी होने के बाद एडिपोज टिश्यू आ गया. सो इंसुलिन इंक्रीज कंसंट्रेशन ऑफ ग्लूकोज ट्रांसपोर्टर 4 एट एडिपोज टिश्यू, skeletal muscle and heart. So after overnight fasting or in diabetes, glucose transporter 4 concentration will decrease at adipose tissue, skeletal muscle and heart. Yes, even if liver was there in the option, liver, then answer would remain same. Okay. Yes. Now, patient with hepatosplenomegaly, cherry red spot at macula, we have discussed Niemann-Pick disease. Niemann-Pick, big was there. Big means hepatosplenomegaly plus cherry red spot. Yes, cherry red spot. So in this hexosaminidase Tay-Sachs disease, in this tiny organ, no hepatosplenomegaly, so this can be ruled out. Glucose 6 phosphatase, this was, yes, this is glycogen storage disease type 1, so symptom would be totally different. Galactocerebrosidase, that is Krabbe's disease, in which you know, मैंने बताया था Krabbe's कैकड़े की तरह सूखा सा, no hepatosplenomegaly, so this can't be answer. Answer is A. Option was aryl sulfatase, that is metachromatic leukodystrophy, in which no cherry red spot. Neurological symptoms would be there. Neurological symptoms present, no cherry red spot, no hepatosplenomegaly. Okay. Glucocerebrosidase, if glucocerebrosidase, you know the symptoms, they are crumpled tissue paper appearance and different symptoms, you know. Okay. Carbon monoxide and cyanide lead to death. Ye same question. Yes, cyanide and carbon monoxide, that is ide complex 4 is inhibited, cytochrome C oxidase is there. Okay, so thank you.